It seems as though inflammatory bowel disease is being diagnosed more frequently because we are more on high alert of it in terms of our gastroenterology approach. When young folks come in with rectal bleeding, diarrhea, abdominal pain, we send them for scans or for endoscopies or colonoscopies that can potentially diagnose IBD.
Why we're seeing an increased incidence may have to do with the fact that patients are living longer and we have more technology to help diagnose the disease itself, but we are starting to see an increased incidence. Rush opened a new Rush Crohn's and Colitis Center, and what it is it's a multidisciplinary center that allows for patients to be seen by numerous specialists within the same day. The clinic is comprised of gastroenterologists, colorectal surgeons, mental health specialists, and psychologists, as well as dietitians. We know that inflammatory bowel disease is multi-level care, and that's why we've decided to create this clinic and the conference.
We have a large team of physicians who are trained specifically in inflammatory bowel disease, the diagnosis and treatment of it.
So the clinic meets, or the conference meets, every other Thursday, and patients that are coming in, we take about an hour or so to talk about each of them individually, and we come up with a plan as a whole and as a team about what we think that patient would benefit from before they come in to see us. And then the patients actually see us on that same day, and they're able to see anyone on our team that we think they may benefit from, and they're able to walk out the door that day with the answers that they're looking for in terms of how to move forward and the next steps with things. I actually have Crohn's disease, which is part of the spectrum of inflammatory bowel disease along with ulcerative colitis. I was diagnosed with it in high school, and of course when you're 16, I don't think you know right away that you're gonna eventually be a gastroenterology physician assistant. But as I grew up and went to college and started studying, I really realized what a passion I have for gastroenterology and for inflammatory bowel disease.
IBD awareness is so personal and important to me because I was diagnosed with ulcerative colitis when I was 19 years old. Like a lot of patients with IBD, it took many months for me to get my official diagnosis.
I work in the Department of General Surgery and Colon and Rectal Surgery, so I work with our 4 colorectal surgeons. A lot of people who grow up with a chronic illness find themselves pulled towards medicine and healthcare, so I was definitely one of those people. And in our department alone, both general surgery and gastroenterology, there are 4 physician assistants that all have IBD. So I was diagnosed with Crohn's disease when I was 15 years old. So from a very young age, I have known a lot about the diseases. I think that obviously that's one of the reasons that I chose to go into this very specific specialty.
IBD awareness is important to me because I've had ulcerative colitis since the age of 8. It's a disease I've dealt with most of my life, and it's a chronic illness that has impacted me. I was recently in the hospital for my ulcerative colitis, and the multidisciplinary team came around to my room and my case was discussed with the different providers. The gastroenterologist, the surgical team came up with different treatment plans for me. It was great. It's really important in the care for IBD patients to have a multidisciplinary approach. And so, Rush has been a great advocate for that.
So we all met through work and also through school, and it's really great that we have so many personal connections to the disease, because obviously it makes my job as a provider so much better that I can really empathize with my patients.
So in the last couple of years, there have been new biologic treatments, both injections or IV infusions, for the treatment of inflammatory bowel disease. In addition, our Department of Gastroenterology at Rush is researching the gut microbiota, as well as how sleep impacts the progression of inflammatory bowel disease, the impact of alcohol on inflammatory bowel disease. So by thinking outside of the box, outside of the disease, and looking at other factors such as sleep, alcohol, diet, bacteria in the intestines, we're learning so much more about inflammatory bowel disease and how to treat it.
We can utilize each other as resources for referring our patients to one another and working collaboratively as well and discussing, what we would recommend or what our team would recommend, but also having a personal approach to it as well, maybe thinking about what's worked for us before or what hasn't.
That's not something that a lot of institutions have, and it's something that at Rush we can really offer something unique for our patients.
it just so happened that we all came together to work here, not knowing that we all had IBD. I think that it benefits the patients who might know about our diagnoses. All of us are pretty open about it, knowing that they're not alone and that we are happy and treated and can work and live normal lives despite being diagnosed with IBD.